Sometimes there aren't early warning signs for lung cancer. Some people with lung cancer don't develop symptoms until later on. What I will say, though, is that yes, even though people don't always have early warning signs, there are signs that should raise your alarm, as well as your doctor's, to make sure lung cancer isn't going on. These are also signs and symptoms that do happen in people who have lung cancer. So I'm going to tell you what they are, guys. I'm Dr. Jen. It's good to see you. Let's jump in, okay? A cough. And that might seem self-explanatory, but I'm talking about a cough that, number one, doesn't go away. So this is, first of all, a message to you that if you have a cough that does not go away, it's got to be evaluated. We generally always need to find out the root of a cough, okay? So a cough that doesn't go away, or a cough that gets worse over time, are potential warning signs for lung cancer. But I would also say something like coughing up blood. Now that seems like a no-brainer, but the truth is, sometimes I've had patients actually chalk coughing up blood to something else. Coughing up blood should always be a warning sign for you to seek treatment and make sure that you know what's going on. There are other symptoms. Hoarseness. I always say hoarseness is one of these symptoms that we are very, very careful about in the medical community, because hoarseness that doesn't go away, that's unexplained, we have to make sure it's not cancer. So do not allow yourself to be hoarse and not know why, not have it go away, not have it resolved. That is not okay. That always requires a treatment, or rather, excuse me, that always requires evaluation. And if there's something to treat underlying that's causing the hoarseness, treatment, of course, as well. Some people with lung cancer, and I'm not sure that this would necessarily be an early warning sign if they get this, but some people do feel a sort of a constant pain in their chest. That may be more of a later sign, but that certainly can happen with some. Some people get recurrent lung infections, bronchitis, pneumonia, things like that just sort of keep coming on and on and on. Frequent lung infections, should probe you and your doctor to be looking further and making sure you're understanding, okay, what's changed? Is there something that has changed? What's going on? Why are these infections happening? Is there lung cancer or some other condition? So frequent lung infections, don't just write that off as, oh, I'm just super sick this year. Make sure you're getting that evaluated. I would also say shortness of breath, that's one thing, worsening shortness of breath, or shortness of breath, period. Shortness of breath can be a number of things, from your heart to your lungs to deconditioning to sort of many things, right? But shortness of breath is one of those entities, kind of like what I said, a cough, like hoarseness, that in the medical environment, that's something that always needs to be evaluated, always needs to be worked up, that we need to figure out why you have that. Also, wheezing, if wheezing is not typical for you, right? That's not necessarily everyone's sign for lung cancer, but that certainly can be for some people, okay? Those are some, what I would say, more early signs, if there is an early versus late, and there are. I'm going to give you some of the later signs. Just so that you know, once again, everyone is different. There are some people who will not present with any of the things I just mentioned, and I've had that. I've had patients present with lung cancer with none of the symptoms I just told you, but rather present with some of the later stages, or rather later symptoms, which I'm going to tell you about now. Everybody's path is different, and some people don't even have early warning signs, but if there are warning signs, they may be some of the ones I mentioned. Okay, later stages, later symptoms rather, weight loss that is unexplained. Unexplained weight loss for any reason has to be evaluated. Also, a symptom that we worry about potentially being cancer or something else. Decreased appetite, bone pain. That's not a good thing. We always want to understand that. Headaches, blood clots. I would say something I tend to see a lot more in the office, because people will walk in with this, right? Instead of, say, being hospitalized with a blood clot, they'll walk in having lost weight over a period of time, or they'll walk in having decreased appetite or things like that, having sort of pains, aches and pains that they didn't have before. There are other potential later stage symptoms as well as early stage symptoms. Those are just a few of them in those two buckets. But just sort of listen to your body. This is the bottom line here, is you know your body best. If something doesn't seem right, make sure you're getting it evaluated. Make sure you're also having your family get evaluated as well. I have another video on the common causes of lung cancer. And yes, smoking is number one, but you might be surprised at the other causes. Make sure you check out that video. I'll make sure I link it to this, or just DM me for that if you don't see it. I'm Dr. Jen Caudle, practicing family physician. on-air health expert and video creator. I do daily videos on Facebook. Please like and follow my page. Please, for those of you who send stars, thank you so much in advance. On YouTube, please subscribe to my channel. Click the little bell for updates. I have subscription groups on both platforms, so please join for private lives. Also on Instagram as well. Go to my website, drjencaudle.com, for my health newsletter. Guys, I'm Dr. Jen. I'll see you soon.